Hi, so my first video is going to be shoulder flexion manual muscle testing, gravity resisted. So my client will be seated in a comfortable position and I will be standing on the side of the testing shoulder. My stabilizing hand will go on his anterior deltoid over the anterior proximal portion of the humerus, and the working hand will go on his humerus distal portion to help move it along. So first, before performing the actual manual muscle test, I will have him do passive range of motion of shoulder flexion. So I will lead him into passive all the way up while still stabilizing and palpating, and then back down. Perfect. And while my stabilizing hand continues to stay on the anterior deltoid and proximal humerus, I will have him do active range of motion of shoulder flexion. So go ahead and go to active. Perfect, and back down. And I'm going to stop him at 90 degrees, and my working hand goes over the distal portion of the shoulder and proximal portion of the humerus, and I will apply pressure for a hold of 3 and have him resist. Ready? 1, 2, 3. Perfect. And that was a grade of 5 for normal strength. For shoulder flexion manual muscle testing, gravity eliminated, the patient will be side lying position and the assistant stands behind, and I will have the patient do shoulder flexion passively first. The stabilizing hand again goes on the anterior deltoid and proximal humerus to stabilize and palpate. And my working hand can then help him do passive range of motion first. Perfect. And then for the actual test, I will have him do active range of motion while still stabilizing and palpating. So go ahead and do that same motion one more time. Perfect, and back down into shoulder extension. Awesome, and that was a grade of 2 for normal. All right, for my next one, I'm doing hip abduction, manual muscle testing, gravity resisted first. So my patient will be in the side lying position, and the assistant stands behind the patient, and I will stabilize with my working hand over the pelvis right here, and my working hand will go on the gluteus medius just above the greater trochanter. And I'll first have him do passive range of motion hip abduction. So go ahead, move in here. My working hand moves to the calf to help support, and back down for hip abduction. And I'll go back with my working hand to the gluteus medius, just above the greater trochanter. And this time have the patient do active range of motion hip abduction. Go ahead up. Perfect. And go down a little bit right there. Perfect. And hold right there. My working hand then moves to the lateral distal aspect of the thigh, and I'll apply pressure while still stabilizing with my stabilizing hand over the pelvis in the direction of hip adduction. So go ahead and I'll resist. 3, 1, 2, 3. Perfect. And that was a grade of 5 for normal strength. For the last one, for hip abduction, gravity eliminated, the client lies supine, and the assistant goes on the side of the testing hip. My stabilizing hand will go over the pelvis, and the working hand goes on the gluteus medius, just above the greater trochanter. And I'll first have him do passive range of motion hip abduction. So I'll use my working hand to help him into hip abduction by placing it on the calf. Perfect. And I'll have you do that one more time. Not yet. And I'm going to go back to palpating over the gluteus medius. And this way he's doing gravity eliminated, so he doesn't have to actually work against gravity. Go ahead and do active range of motion hip abduction. Perfect, and back into adduction. Awesome. That was a grade of 2 for normal strength.